Today I wanted to talk to you about how to get rid of swelling in your hand. I have another video on how to get rid of swelling of your fingers using Coban, so you can look for that video if you're interested. So first I just like to mention to you to investigate and find out why you might have swelling of your hand. Look at your diet. Sometimes a diet high in caffeine and salt intake can cause some persistent swelling in your hand. Medications can cause that as well. Obviously an injury can cause acute swelling to your hand. So it's always important to find out what the reason is so that you can address that. And once you've figured that out, then there are other ways to help further that along and eliminate your swelling, or at least make it decrease so it doesn't begin to cause pain in your joints and cause contractures, which that can lead to losing your range of motion of your hand, which you need those hands. So I was going to talk to you about edema gloves and compression sleeves. So edema gloves are great for if you have swelling that's in your hand. Compression sleeve is good if you only have swelling, say, maybe just into your wrist. And maybe your fingers are fine because you've been able to move those, but maybe the top of your hand is a little swollen, or you have some swelling into your wrist. Now, I don't necessarily have swelling here, so I have a smaller compression sleeve, but these come in several different sizes. And the length that it comes in, you could get 2 or 3 of this size out of the roll that it comes with. Now I'll have these available on my website. If you go to therapyonyourown.com/store and type in the search edema glove or compression sleeve. Now, I will also have the link available on this video as well, and those are an affiliate link and will help support additional videos and this website. So I appreciate that very much. So back to the compression sleeves. They are latex free and they come in a little longer. They come in this size, or they can be a little longer down into the arm, the forearm. Now the ones that I like, and most patients seem to like, are these, the ones that allow the fingertips and the thumb to be free. And that allows for more mobility, that allows you to still have sensation of your fingers if you want to use your cell phone, or if you need to feel to pick up small objects. It's also good for you to keep an eye out on the tips to make sure that the glove's not too tight and it's not cutting off the circulation. Now, if you like to have more of the fingers free covered, so say your fingertips even swell, like sometimes this can be really tight around the tip and people want to have the whole finger covered, and they have these nice gloves that cover the whole entire finger and thumbs like a real glove. And when you put these on, you want to make sure you put it on all the way down and make sure you go through the your web space here to make sure this is nice and smooth and tight and uniform throughout the whole entire hand. Now you want to make sure you don't have too many wrinkles. So down here, this one might be just a little bit too loose on me. Up here is not too bad, because when I pull and pinch here, I'm not really pulling up any extra fabric. So I feel that this is a pretty decent fit for me. Now I like the fit of this one better because I didn't have any kind of creases, and I feel like it fit my hand better without too many additional creases. One of the most important things is to make sure that the seams are on the outside of the glove here, that you're not turning it the way that you think it may be. So most people think the seam should be on the inside, like our clothes and other gloves, But for these, the seam needs to be on the outside so it's not digging into your skin and causing restrictions of your lymph system, because it's trying to get the fluid out. And you don't want to cause sore spots in your hand as well. Now, on occasion, you'll have more swelling on the back side of the hand than the front part of the hand. But if you can't seem to target those areas, a little tip that I like to show is that you take some gauze and you just pull through your web space, and then you'd want to get another one or two here to put around your thumb and your small finger, and then you just kind of make sure that that's covering the space like your palm and the back of your hand, and then you just put the glove on. And if your hand sweats too, that's always good to have some gauze to help kind of capture some of that sweat. Now you don't have that bowing, and there's constant contact of something to allow compression in your palm and in the back of your hand. Now, if this doesn't go down far enough and you have additional swelling down into the forearm, you can use both. You can use the glove and the compression sleeve. Now, I've cut the compression sleeve for my thumb to go through, but you don't have to. But what you can do is cut it for your thumb, and then now you can pull it through and have additional length down the forearm here. Like that. Or you don't, like I said, you don't have to cut a hole, so just pretend there's not a hole there. And then you can make this go down even farther down into the forearm and even into the elbow. And if you need to get maybe one size bigger because your elbow is swollen, then you would then feed it through and go up into the elbow. You can also use an ace wrap too if you wanted to ace wrap it. You would always start from the highest point and ace wrap up, not the opposite way, or else you would make the swelling go down and make your swelling worse. That's an option, but most people like a sleeve because they don't have to do this constant wrap from an ace wrap around their arm. Just make sure too that there's no space between the glove and your compression sleeve. So like you wouldn't want to leave it like this and then have extra space here free where this would potentially swell up, okay? So, and then just to remove it, you would just kind of gently pull up and then just slowly pull nice and gently to care for it. And then those off. And you can machine wash these in gentle cycle, or I prefer to just hand wash them. And it's often beneficial to get 2 of these. That way, if you are using one for activities, you have one that can kind of get dirtier, and then one maybe for nighttime or after you've showered. And I usually recommend people to wear these most of the time to help with getting rid of the swelling more consistently than taking it off and on, off and on. You might not notice as much of a change at first if you're constantly taking it off. Obviously take it off to shower, but to have more of a consistent decrease of your swelling, you'd want to wear it more consistently. But if you're only having, the other thing is if you're only having swelling at nighttime and say you wake up in the morning and that's when the swelling's worse, then you may only want to just wear it at nighttime. And if it's not limiting your mobility during the day, then you wouldn't need to wear one during the day. But if you notice with activity that your hand seems to swell, then I would definitely get one that you can wear like this one to still allow you to use your hand with activity, but still helps combat the swelling. So again, I'll have those on as a link.